It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated and medically complex adults and children with tracheostomies or ventilation by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I shared mismatch between demand and supply of end-of-life care, introducing competition and informed user choice into human services. You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to share a story from one of our clients, and the title this week is How to Stand Up to a Government Health Department and Win. The NDIS, or the National Disability Insurance Scheme, has been described as the quote-unquote holy grail and the problem to all solutions for the disability sector. Whilst this may be accurate for some people living with a disability who had no support at all to this point, it's certainly not accurate for people living with complex medical issues. The federal and also state governments are trying to quote-unquote sell a quote-unquote one-size-fits-all solution to people with a disability, and they're also trying to get medically complex patients into the NDIS scheme. For example, medically complex patients with tracheostomies, mechanical invasive or non-invasive ventilation, regular seizure management, PEG management, suprapubic catheter management, etc. are missing out on crucial funding for home care with specialized and accredited services like intensive care at home. The NDIS is not funding registered nurses, and in the meantime, medically complex patients with tracheostomy, mechanical invasive or non-invasive ventilation, regular seizure management, PEG management, suprapubic catheter management, etc. are either staying in intensive care for way too long and costing departments of health, and also the TAC or the Department of Veteran Affairs, etc., more than $5,000 per bed day. Even worse, some of those patients are at home with very little NDIS funding and are looked after by non-qualified support workers or by parents or other family caregivers who are struggling to keep their loved ones alive or out of intensive care. It is a massive dilemma, and state as well as federal governments are trying to turn a blind eye on it as much as they can, and by doing so, they are willingly and knowingly risking lives. It is common knowledge in the industry that in late 2016, a medically complex toddler with a tracheostomy and regular seizures died in Melbourne because they were only looked after by support workers who couldn't manage a medical emergency, which ultimately led to the death of the toddler. A very short-sighted, money-saving exercise by funding bodies leading to the death of a toddler and willingly risking lives without looking at what is required clinically. This has always been Intensive Care at Home's mission, to provide services around clinical needs and not around perceived funding available. As long as an ICU bed costs $5,000 per bed day, and we at Intensive Care at Home can cut the cost to 50% of the cost by providing intensive home care, there is a relevant economic as well as clinical argument to use such a service whilst providing quality of life for patients and their families in a holistic home care environment. In order to illustrate this with an example from one of our clients, I want to share the story today, how to stand up to a government health department and win. So today's article was actually first published on the wikihospitals.org website, and you can read it. I have put the link to the article on the wikihospitals.org website in the link below this video. And if you are watching this on YouTube, just click on the link below this video and it'll get you to the article. So I'll read out the article for you today. And it starts. The Phillips family are fighters and winners. Indy was born with Rett syndrome, a cruel genetic disease that can cause physical deformities, seizures, and life-threatening cardiac arrest. When she was first diagnosed with the disease, doctors said that Indy would not survive her childhood. Instead of accepting a life of disability, Michael and Noelia insisted their child have as normal a childhood as possible. Indy is cared for at home, looks after her horse on the family farm, and attends a special development school 4 days a week. With every hospital admission, Indy has fought hard to recover. Therefore, giving up is not an option. Until now, funding for Indy's care has come from the state government body, the Department of Human Services. The funding program is called an individual support package. It supplied a limited sum of money to be spent on carers and support workers to assist with general living supports for people with disabilities. It does not, however, supply money for qualified nurses to provide the medical care necessary to keep people away from costly emergency hospital visits. The presumption in this bureaucratic funding model is that people with disabilities are clones with identical medical needs. Having a disability always means you are, quote-unquote, medically stable. And if you are medically unstable, you are better off in the back of an ambulance after you have collapsed, rather than being managed at home by qualified intensive care nurses who can prevent deterioration. A bureaucratic catch-22. Michael eventually found a local registered nurse called Chris, who was prepared to work part-time for a carer's wage. Chris has now been with the family for 4 years. Michael and his wife have been alternating, taking turns caring for Indy with working paid jobs to support the family. They also run the farm and try to remain as self-sufficient as possible. Make the best of what you are given and ignore what you can't fix is Michael Phillips' motto. Indy was still ending up in hospital after having seizures. In September of 2015, a hospital nurse referred the Phillips family to a new service called Intensive Care at Home. This company keeps unwell people in the community away from expensive hospitals and in the comfort of their own homes. Its founder is Patrick Hutzel, a critical care trained nurse. Patrick has previously worked in a similar nursing service in Germany. When he moved to Australia in 2005, Patrick decided Australians with disabilities would really benefit from this service. Germans have the legal right to receive their medical treatment at home if it can be delivered this way. German health insurance companies are funded by taxes. However, they all have to compete for customers, and if Germans don't like their insurance plan, they simply move to another one. This makes German health insurers competitive and responsive to their customers' needs. German health insurers are also financially responsible for the overall cost of treatments, both in and out of hospital. This means that long-term savings from keeping people out of expensive intensive care units are a bonus for them. In stark contrast, Australian health services are fragmented across a range of state and federal government departments. They focus on unrelated and short-term goals. Communication between departments is very poor. Financial costs of services purchased are rarely a consideration. And the tax-paying public have no way to influence the way their medical treatments are delivered. Wouldn't it be better to give Indy and her family full-time trained intensive care nurses and keep her out of hospital emergency departments and intensive care? Asks Indy's dad, Michael Phillips. When Patrick heard about Michael's situation, he offered a flexible solution. His company worked with Chris and provided limited hours of intensive home care nursing. Patrick also closely monitored Indy's hospital admissions to see if they could be prevented. At the end of August 2017, Indy was admitted once again to hospital with aspiration pneumonia after a seizure. Michael and Patrick then approached the health department for an increase in funding for his service. They had extensive documentation, including all the paperwork from Indy's prior hospital admissions and medical and nursing reports. The bureaucrats relented. Funding for the intensive care at home nursing service providing 20 hours a day was eventually granted in September 2017. When Michael heard the news when he was at the Royal Children's Hospital with Indy, him and his wife burst into tears with relief. The family finally had a chance to relax, knowing that Indy was finally being cared for by professional intensive care nurses. However, this good news was not to last. The National Disability Insurance Scheme, the NDIS, was one of Labour Prime Minister Julia Gillard's most important policies, claiming to provide permanent federal funding for people with disabilities. The legislation was passed in November 2013, and in 2016 it began to be implemented across Australia, region by region. The ongoing cost to the Australian taxpayers is expected to be $22 billion per year. The scheme has been heralded as improving the quote-unquote quality of life and social participation for people with disabilities. However, the National Disability Support Team left out one essential detail: funding for registered nurses. Michael only became aware of this detail when the State Health Department began to discuss his transition from his state government funding plan to the new federally funded NDIS. Concerned about his daughter losing her intensive care at home nursing service, Michael had a meeting in November 2017 with the Department of Human Services Intensive Support Team. Despite Michael's concerns, the State Health Department signed off on the new package on the 28th of December 2017. From their point of view, Indy's care would now be funded by the federal NDIS. Michael refused to accept the proposal. He knew that Indy would die without ongoing and qualified intensive home nursing care. And when it comes to his daughter's welfare, Michael Phillips refuses to back down. On Thursday, the 8th of February 2018, the State Health Department rang Michael to say that Indy's funding would be cut in 10 days' time on the 18th of January. Michael was told that he had no option but to accept the NDIS federal package. The bureaucrats expressed sympathy and arranged a meeting on Monday, 12th of January, to discuss this. At 6:30 that evening, Indy had a seizure, followed by vomiting and aspiration. An ambulance was called, but she deteriorated quickly into respiratory and then into cardiac arrest. An air ambulance, 2 MICAs and an air ambulance were called. She was flown to the Royal Children's Hospital and admitted from emergency straight into ICU. While Indy was fighting for her life in the intensive care units at the Royal Children's Hospital, Michael fought to tell her story. Whilst knowing it would anger the State Health Department, he contacted lawyers, the Herald Sun, the Victorian Ombudsman and Melina Barth, member for Eastern Victoria with the Nationals. Thankfully, the response was immediate. The State Minister for Disability, Martin Foley, rang Michael on the 13th of February. He apologised for what the family had been through and gave a verbal guarantee that Indy's nursing care would be covered no matter what shortfalls existed with government funding. This guarantee is now also in writing. Michael received an email on the same day from Sharon Fisher, the director of the South Division of Gippsland. She advised him that the current funding would remain in place while the department continues to work with him regarding Indy's care. Indy's story was published on Wednesday, the 14th of February 2018 in the Herald Sun. Michael feels as though his daughter is being treated as a burden to be got rid of. When he asked state government bureaucrats how these problems have occurred in the first place, some privately suggested that the NDIS may have been pushed through too quickly. Michael's point is that behind government statistics is somebody's life. Michael says, in the private sector, wages are linked to outcomes. People are open about problems and expect things to be resolved at an acceptable price. If you do a bad job, you lose your job. Michael's work history is supervising building contractors in Eastern Victoria. Problems on building sites ended up on his desk. If something was broken, it had to be fixed immediately. In Michael's experience of the health industry, there is no sense of urgency about solving problems, yet people's lives are at stake. Health bureaucrats are able to receive a good wage and excellent conditions while doing a bad job. In the public health sector, Michael believes there isn't a downside for doing a bad job. Meanwhile, the implications of their mistakes affect families for the rest of their lives. Michael describes himself as an ordinary father trying to make people aware and make a difference. He wants to stand up for other people in a similar situation. He believes that legislation to be changed so that NDIS can cover medical costs, and that health funding should be coordinated and easy to negotiate. So thank you for reading this article or listening to the video version here. Again, you can find that article, the original, at the wikihospitals.org website. Now, if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or we can also help your loved one getting out of a nursing home, or if you find that you have insufficient support at home for your loved one on a ventilator, and if you want to know how to get funding for our service or any questions at all, please send me an email to patrick@intensivecareathome.com. That is Patrick, just with a K at the end, or you can simply call me on one of our numbers that you can find on the top of the website. Also, have a look at our careers section. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne and in South Gippsland, Victoria. We are a TAC and DVA approved community service provider in Australia, and we also receive funding through the Department of Health. We also have been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.